What is HPV and how do you get it?
Well, first of all, HPV is a sexually transmitted disease. It was discovered years ago, actually in the 1960s it was first discovered, but it was not cloned until the early 80s, and they were able to identify HPV as the cause of cervical cancer. Now, there is two major strands of HPVs, the high risk and the low risk. The low risk are associated with venereal warts, and those are associated with HPV 6 and 11, while the high risk are associated with cervical cancer. The first identified were 16 and 18, and then they found out 31, 33, and so on other HPVs that were associated with cervical cancer. Now, knowing that the HPV was originally associated with cervical cancer, they tried to discover what else was the HPV associated with. So it was found out that it was associated with penile cancer, as well as rectal cancer and oral cancer. Of course, all of these diseases are sexually transmitted diseases. And they have been able to develop a vaccine that protects for you to developing the majority of these diseases. Now, in order to be vaccinated, because it's a viral disease, you should be vaccinated prior to exposure. If once you're exposed, most likely you're not going to have the protection that you will if you're vaccinated prior to exposure. And the idea is to vaccinate young girls and boys. When the first vaccine came out, it was only given to women or the girls. And then it was figured out that men would transmit these diseases, even though they were most likely asymptomatic. And then we started vaccinating our children.
Now, papilloma literally means warts, but it doesn't mean you definitely have warts or have to get warts in order to have HPV, correct?
Correct. Well, the papilloma definitely in Latin means warts, but the papilloma warts are the ones that are benign. The 6 and 11 are associated with benign warts, as opposed to the high-risk HPV, which does not show those lesions that we expect to have as a wart, most likely. Now, histologically, they're very similar, so you look under the microscope, they have similarities. That's why they are associated with the look of a papilloma itself. But they're definitely, the Latin word is warts, yes.